I describe these 3 weight loss surgeries as a big surgery that is done in a small way.
Almost 99% of what we do is laparoscopic surgery, which is known as a minimally invasive procedure. What is a minimally invasive procedure? We do the major surgery through very small incisions with less patient pain.
Even though you're performing a very big operation, the patients are actually able to go home the same day or the following day. The adjustable gastric bandings will go home the same day. The laparoscopic gastric sleeves and the laparoscopic gastric bypass surgeries, surprisingly enough, will be ready to go home tomorrow. In other words, they will be able to go home the following day. When I hear the question from the patient asking me, when am I going to be able to work, my safe answer is always 2 weeks. I think 2 weeks gives me enough freedom to say this patient will be safe to go back to work, provided that they don't have strenuous activities with lifting, pushing, or pulling. But for the most part, in 2 weeks, they should be safe to go back to work. We can expect that the weight loss achieved after surgery will be permanent for the most part.
As long as they follow the same lifestyle routine and learn the lessons they learned in the first 1.5 years, yeah, they can keep the weight off.
The lifestyle changes as far as diet has not been difficult. My family eats like normal, and then I just eat a smaller portion. So it's more portion control, not so much what they're eating, so it's not as restrictive as some diets were.
The main changes that the patient can expect after weight loss surgery are, for the most part, very rewarding for them. They will obviously notice that they can continue to eat. At the beginning, they will obviously be limited, and they will have to progress from a liquid to a soft to a regular diet. There will be a limitation on how much food they can hold, and they will feel early satiety. That, to me, is the most important change that they will experience. But that change alone is going to be the one who is going to result in the weight loss that we're trying to achieve. The patients will be able to live a normal life. They will be able to go back to work, back to exercise, with the big advantage that they will see how their weight starts to come down, how their clothes sizes start to come down, how they can move easily, and they can start engaging in activities that they couldn't do before. And in addition to this, they will also be noticing how the medical problems that they've been suffering with and all the medications that they have been taking for a long time start to be obsolete, and they can actually have an easier management of their medical conditions.
I can now jog, which I hadn't jogged probably since I was in junior high school. My feet don't swell at the end of the day. I can take several flights of stairs at a slow trot and not get out of breath. It's been very rewarding for me.